For my psychology and film project, I chose A Beautiful Mind. A Beautiful Mind is actually based off of a true story and follows John Nash, who is a brilliant mathematician. The movie shows the progression of his life from starting off at college to getting married to eventually the discovery of his disorder and what his life is like as a schizophrenic. Nash's first noticeable hallucinations were early on. Actually, the first was when he hallucinated a roommate that doesn't exist. However, the most extreme hallucination Nash faces is when he convinces himself he must decode encrypted Soviet telecommunications, which is just a complete delusion on his part. So I diagnosed him with schizophrenia, specifically paranoid schizophrenia, which is the most common form. It is characterized by relatively stable yet often paranoid delusions that are usually accompanied by hallucinations. The common symptoms are disorganized speech and thought, reduced speech, social withdrawal, absence of pleasure or motivation, hallucinations and delusions, and lastly, flat affect. The symptoms that Nash portrays are delusions and hallucinations. The first being when he deludes himself into believing Charles is real, his roommate, and then that progresses when he goes on later in his life to Charles having a niece that also does not exist. A second example of this delusion is with the development of Parcher and his assignment to decode Soviet messages. The second symptom is disorganized thought. So when he was working on his assignment to crack the Soviet code, which is a delusion, John displays a common characteristic of schizophrenia through his extremely disorganized and somewhat neurotic wall of pictures, thoughts, and ideas. A missing symptom of schizophrenia that John doesn't have is absence of motivation. While some patients of schizophrenia experience a lack of motivation, John did not appear to be affected by this characteristic. In fact, he was so consumed with his motivation to crack the Soviet code that he became obsessed with the concept and couldn't focus on anything else. A possible treatment for Nash is medication alongside psychosocial therapy for the rest of his life, because schizophrenia is a lifelong disease and it requires lifelong treatment. The two work best together as they enhance the benefits of one another. The medicine will help lessen the effect of Nash's hallucinations, while the therapy will allow for a professional to guide him in controlling his disease in his daily life. The outcome of this is that Nash will be eventually able to live a relatively normal life with significantly less paranoia and hallucinations. But if these symptoms do return and consume his life as they once did, he will have the resources through his therapist to lessen them before they get out of hand. However, one concern to this treatment is that it puts a lot of responsibility in the patient to take the required medicine in the correct doses, as well as to be fully honest in therapy about his delusions. Disorders in film generally tend to be much more drastic than is the actual case for many patients. This causes societal perceptions of disorders to be much more extreme and life-consuming than is actually the case for the majority of people affected by mental disorders. This misrepresentation of disorders in the media can cause many people to feel more alienated and less understanding of patients who suffer from mental disabilities. Specifically in A Beautiful Mind, the portrayal of schizophrenia is generally on par with what patients in real life experience, but it is a little bit extreme. The delusions that Nash experiences are more drastic than the average schizophrenic, who usually just experience auditory hallucinations. But still, in the end, Nash goes on to have delusions that are completely possible for paranoid schizophrenics to have, so it is an accurate representation of the disorder.